Hello everyone, my name is Simon. I am an occupational therapist and a certified hand therapist. Today I'm here to present my case report as a poster. Before I dive into my presentation, I would like to give you an overview how this presentation will look like. First, I will talk about the introduction. Second, I will talk the uniqueness about this case report. The third, I will introduce the case. Fourth, I will talk about the treatment protocol that was being used. And the fifth, I will discuss the case with the literature. And finally, I will conclude with a takeaway message. Without further ado, let's dive into this presentation. So today's my topic is the effect of conservative management on bilateral subscapularis heterotrophic ossification following burn injury. So what is an heterotrophic ossification? Heterotrophic ossification is nothing but when a soft tissue becomes a laminar bone, then we call it as heterotrophic ossification. The heterotrophic ossification is a common complication following a burn injury. If you look at the prevalence rate, it's usually from 0.2% to 4% after burn injury. So what is the uniqueness about this case report? There are two reasons why this case report is very unique. The first reason is there is only 3 reports so far published about the subscapularis heterotrophic ossification. None of the case report was talking about the bilateral subscapularis ossification. They talked about the unilateral subscapularis ossification. So this is the only case that talks about the bilateral subscapularis heterotrophic ossification. The second reason is all the 3 case studies that were talking about the effectiveness of surgical intervention. None of them was talking about the conservative management. So for this reason, the case report is very unique. So let me introduce the case to you. I have been referred a 52-year-old very pleasant gentleman, a truck driver by his profession, which was referred to us following a 3rd-degree burns. He sustained a 58% of burns. While he was camping, a propane tank blew up, creating a 3rd-degree burns. But at the time this gentleman came into our clinic, his shoulder active flexion was 60 degrees and shoulder active abduction was 60 degrees, and both the internal and external rotation was 20 degrees. And his DASH score, what is DASH? DASH is a disability of arm, shoulder and hand score. So the DASH score was 35%. If you look at the therapy program, the patient underwent a 6 to 8 weeks of therapy program, which includes active stretches, active assisted stretches, and grade 1 and grade 2 joint mobilization. At the end of the 8 weeks, the patient's active shoulder flexion was 170, and his active shoulder abduction was 170 degrees. The internal and external rotation of his shoulder was 50 degrees. This DASH score was 85%, and there was also a significant difference between the pre and the post short form L survey. The SF36 was also significantly different between the pre and the post score. If you look at the literature, it's very unclear whether the conservative management is effective for heterotrophic ossification. There are 2 schools of thought. Some authors they believed on the passive range of motion exercises, while others believed on the more aggressive joint manipulation. Even though the risk for heterotrophic ossification is greater with the joint manipulation, they believed on that. But In this study, the patient underwent an active and active-assisted shoulder rehabilitation. Some of the limitations of the studies are because the result cannot be generalized because of the low sample size. There need to be a study with a larger sample size to determine whether the conservative management for heterotrophic ossification is effective or not. The important takeaway message from this presentation is the conservative management can be an option for the therapist when they are treating the subscapularis heterotrophic ossification. I personally believe that the patient's strong desire for the mastery would have also be an important factor for his success in this case. Thank you for your attention. I hope you enjoyed this presentation.